Okay. I was on the way to a meeting one summer morning and I noticed a problem in my vision. And 2 days later, I was in a retina specialist's office being told I needed injections in my eyes. And that was my wake up call that, maybe I want to consider something else. So I went home, started looking at the literature, and I found some good protocols that made sense and ended up needing one therapeutic in a wellness center here in Spokane. And in that center, they had a BEMER. And the practitioner asked me if I'd like to have the BEMER session complimentary to what I was there for. I said, sure. So I had one and it just relaxed me. And I was going weekly for therapy in this center. So I noticed my right hand, I couldn't straighten out my fingers on my right hand. And I knew that condition was treated by surgery. I didn't want surgery, even though I was a surgeon. I just assumed not have anything invasive if possible. But I noticed my right hand started getting better. And I thought, wow, since I knew that was treated by surgery, that was getting better. I thought, well, what else could be going on? What else could be better? Right. So I got a second opinion regarding my eyes. And the physician I saw said, Debbie, I think if you would get a BEMER and use it twice a day, your eye condition would improve. So I thought, and the alternative was eye injections. So I thought, eye injections, get a BEMER. I'm getting a BEMER. So I got the BEMER. My hand condition completely resolved in a month of using BEMER twice a day. My eye condition, it took about 18 months by objective studies in his office to see a reversal. Subjectively, it was sooner. And my walking, I couldn't walk off of an airplane up the jet bridge straight to baggage claim without sitting in the terminal first. The walking and going to the grocery store, I couldn't get to the front door of the grocery store without my hips fatiguing. So all of that resolved in about a year, slowly, but in about a year. So I was sold. It's like people need to know about this device. And that's when I began to champion it. I absolutely love the BEMER. Not only have I seen it do great things for myself, but people that I've shared it with, my clients, I've really seen some remarkable things with them as well. So I absolutely love the BEMER. I would be more than happy to share what other people would like to know about the BEMER and my experience with it, because it really is quite a phenomenal device. And I'm so thankful that I was introduced to it.
Thank you so much for sharing that story. A lot of us came to BEMER in this way, where we were looking at alternative therapies. And I don't even look at BEMER as alternative anymore. There's really evidence-based medical studies. In fact, one of the most studied pulse electromagnetic field devices in the world. Like I said, the only class 2 cleared low power, low frequency pulse electromagnetic field device here in the United States, as well as it's class 2 throughout the world. So talking about metabolism or enhancing metabolism today, rather than jump right into metabolism on a healthy level, I want to backtrack, because you're not in clinical practice as it relates to surgical oncology at this time, right?
Correct.
Yeah. So, but you do understand this aspect of carcinogenesis and cancer. And this is actually, the opposite of functional metabolism in this way. We talk about senescence, cells begin to not work properly, and they will replicate. They'll move into the differentiate and move into more embryological states in a effort to survive. And so maybe you can look at that or talk about it a little bit. I know that a lot of times you were just cutting out tissue or removing the tissue from the lymph nodes or wherever that might be. But maybe give a little perspective about that, and maybe not just what you saw from a tissue perspective, but as an individual, your patients, how they were managing that, or how it maybe even manifested for them.
I think I can first speak to how it would manifest. Certainly, a lot of individuals start being aware that there's something wrong when they experience fatigue, when they experience lack of organ function, and all of those things start when the cell is impaired in some way, in some fashion, as that slide that you shared with us. As the cell becomes a little more unhealthy, the tissue becomes unhealthy, and then organs and symptoms all follow. So I think not as aware as I am today, but when symptoms would present that were questionable, that we didn't have an explanation for, that was usually an indicator that something metabolic was awry. And unfortunately, in my patient population, the seriousness of what was awry was pretty significant and very life threatening. So that's how I would best describe in clinical practice how I experienced this metabolic dysfunction related, from the cellular level, then all the way up to the manifestation of symptoms.
Sure. And when I look at solid state tumor, you worked on a lot of breast cancer, I'm sure, and metastasis of. When I look at this, these are cells kind of locked into a anabolic process versus this balance of anabolic or anabolism and catabolism through our day-night circadian rhythm in essence, or an effort to survive. We see this happening in nature even. One of the ways I worked also in integrative oncology up in Los Angeles for many years, and not that BEMER is a treatment for cancer in any way, shape, or form, but I use BEMER as an adjunctive therapeutic to support either the mainstream interventions that were done, or if they chose to do integrative or complementary style treatments. And my goal with cancer wasn't to kill, or shut down through chemotherapy, although that's supported in that way, but to actually charge the cells back up by transferring energy. Now we see this with, for instance, repetitive transcranial magnetic stimulation with glioblastoma multiforme. So they're utilizing pulse electromagnetic fields in treatments of cancer, not to lean on in the cancer field, but talk to me about how do you see BEMER transferring energy and supporting metabolism overall, maybe through blood flow as well as directly through the inductive stimulus.
Well, I think one of the things that we talked about initially was the oxygen delivery and the energy that subsequently occurs. And I think if normal healthy metabolism is preserved, because we know in a cell, I think their tendency toward malignant dedifferentiation or dedifferentiation of malignant transformation, I think that process could be halted, or it could be slowed down with restoring a good, healthy environment. And one of the things that always fascinated me was the differentiation process. How from being very similar looking to that a cancer cell looks very an early cancer cell looks very similar to a normal breast cell. And then as it dedifferentiates, that cellular morphology changes. And you have intracellular change occurring in a cancer cell before the morphologic aspect of the cell changes. So that on that level, if you can support some of those processes that may be contributing to that intracellular change going on before the actual morphology of the cell changes, I think that could be another way to think about how to support people and health with something like a BEMER, something that's going to be metabolically helpful in conditions, whatever they may be. But that malignant transformation process was always very fascinating to me, and how the biological and metabolic processes occur before you actually get morphologic change.
You bring really good points here, because if there was a way to get in and get if you could put some jumper cables or something on cells, and once you can see the millivolts, the membrane potential start to drop, you can measure mitochondrial bioenergetics, you could start to see changes functionally before the structural changes ever occur. And that comes down to cellular restoration, and that's mediated and modulated by mitochondrial bioenergetics, the ability to make, produce, and regulate energy. And it's that cellular communication intercellularly as well as intracellularly that really is broken down as it relates to carcinogenesis and the expression of oncology as a whole. I really like that perspective. Moving away from pathology and oncology a little bit, we always think about metabolism, boost your metabolism, exercising. Well, the first way we can talk about exercise, and now you're in more of a wellness type of practice, how do you support your patients in enhancing their metabolism? Maybe it be a healthy body composition or weight loss, however you look at it. Give me some ideas of how you really engage with this these days.
Well, I think there are two aspects that I consider real cornerstones for what I do now. BEMER, I believe, really is so foundational because basic nutrients are oxygen and the nutrients we have in our blood. Those are the basic nutrients for every cell. So you have to have, and not only do you have to have nutrients and oxygen, they have to get to their destination. So BEMER is foundational in everything I do. When people want to get better, feel better, be better at whatever, just daily living, whether they want to be a better athlete, whether they want to perform better, BEMER is foundational. And then after that, I do talk about nutrition and getting the essential nutrients that we all need. I do believe in that aspect because our food isn't as nutrient rich as it used to be. So right. I think it's important to be sure that you're doing something in that vein. And then once you get all of that working together, all of those things are synergistic and just enhance overall health and wellness, no matter who the individual is or what their goal is. So that's really the two places I start, BEMER being foundational in everything I do.
I like that. And what about, so when we think about pillars, you talked about nutrients, exercise, internal exercise with BEMER, this idea of, how about sleep and sleep and exercise. How are you working with breathing with the folks? Or are you, what type of exercise or movement are you engaging with them to help support their overall metabolic function, as well as the recovery aspect? Is that a part of your practice as well?
What I do generally is see where they are and start where people are, and then take it from there. Certainly, I don't do that. I don't have an exercise program per se,
right?
But I do have people that I work with in the community that have all types of exercise that will meet an individual's needs. I'm very much into individual health and wellness and where each individual is, as opposed to having just a across the board recommendation for whoever comes into my office. So I really work with where they are. If they're more sedentary, then we just work on starting to walk, starting to move. If they're an athlete, and depending on what they want, if they're really looking for recovery, which a lot of athletes are. I had a client recently. I asked her what she did for recovery, and when she told me, I about fell over. I said, you need to check out the BEMER. And she was really starting to get into liking to use the BEMER and seeing its value in recovery. So a lot of athletes, you would think they have a good recovery routine, but a lot of them don't. I was been really surprised by that.
You're totally right.
So,
yeah, and that's the difference
so I do
from my perspective. Go ahead.
I was just going to say, so I do recommend the BEMER for recovery, and they are amazed at the benefit.
Yeah, I mean, recovery, as I said in the slide presentation, that's the difference in between an optimal, like high-level performer and not. You can't just go. There has to be a balance. As we inspire, we expire, and that in and out has to be there. And this is what I always say. I mean, if someone's burning the candle at both ends, our autonomic regulatory system is what maintains homeostasis. But if our ANS is recruited for defense or for stress, there's no way it can be rejuvenating or supporting our resilience. And that starts to show up on a cellular level, on a tissue level, organ, and very much like you said, one of the primary symptoms that walks into our practice is, hey, I feel tired, I feel fatigued, even achy sore sometimes. Which really brings me from the perspective of, we have cellular respiration, we have this idea of moving recovery. A question came up that I read here, and they wanted to know how you were using BEMER and what condition it was for the eyes. For the note right now, she can certainly answer this, but via the user manual, the BEMER is not intended to be used over the head, neck, or face unless it's guided by a physician doctor. And from that perspective, I generally will do BPAD over the eyes, low power program 1 with the plus signal morning, no plus at night. How are you recommended, or how did you use it to get the efficacy or the results that you had, Dr. Martinez?
Well, I used the BPAD. I wrapped it around my head with the center coil at the occipital region, and the two, and then the two other coils right by my eyes.
Got it.
And then I would use either intensity 1, no plus, 1, 2, or 3, or I would also use program 1. And I, to this day, still do that. I just alternate between that scenario, and I've had really no issues with my vision. And honestly, to say that my vision has been preserved, I really believe that with the BEMER. And that what a gift! What an incredible gift that has been for me. Again, that's why I'm so so enamored of BEMER and why I like to champion it.
Dr. Martinez, you bring this up, and I'll tell you, I mean, the eyes are an expression of the brain, literally a part of the brain looking out at the world. If we were to break down the tissues and mitochondrial density per cubic centimeters, millimeter, however you want to look at it, the brain is actually the number one populated tissue of mitochondria. So that means there's the most metabolic function, the most need for energy. Number 2 is the heart. Number 4 is the liver. And guess what? Number 3 is the pancreas. It also, and 5 is the kidneys. But all these tissues have very important roles in maintaining structure and function through homeostatic balance of mitochondrial bioenergetics. So it really comes down to energy. And so you're directly transferring energy via the eyes. I've had times where I've been tired and my eyes have been blurry. I've used the BEMER, and all of a sudden, all that tiredness through the musculature, maybe toning it up, maybe allowing it to be in a more toned fashion, I can all of a sudden see clearer. And so you haven't changed your glasses, you said, in some years, or is that true?
That's right. That's right.
Yeah, that's pretty incredible. So you're maintaining, and I see this, I don't generally see reversals, but I do see maintenance. And folks, doctors, healthcare practitioners, wherever or whatever you are out there, we don't necessarily, it's not easy to change and go the other direction, but to change the trajectory of our declination or cellular or the senescence process, that should be our goal every day, whether we're in the practice of medicine or in a wellness type of practice for yourself. One question as well, how do you work with other healthcare practitioners, other wellness educators in your local area of Spokane? Are they receptive to this type of therapy? Are they resistant? I know when I was working oncology up in Los Angeles, brutal to talk about anything outside chemotherapy and radiation. How about you? What's your experience with that?
I would say it's patient-driven. I see patients looking for another way to handle the situation they've been dealt, and then we take it to their clinician and work from that perspective in educating physicians. And I recently had the experience of where I was out in the public sharing BEMER and ran into a number of physicians just by chance. It wasn't a clinician. There weren't clinicians there specifically. And I got a lot more interest than I've had before COVID, I'll put it that way, before we were on our lockdown. Mm-hmm. But the physicians are starting to look to and starting to be intrigued by other things. And the fact that there is literature behind BEMER and the fact that there is literature about microcirculation. I mean, when you look at PubMed.gov and the increase in the number of publications related to microcirculation over the last 2 decades, it blows your mind. I mean, we weren't educated about that, at least when I went to medical school, I wasn't. And so, and when I look at, when I was in medical school and publications in that time frame, they weren't existent. There were very few. So this is all a new field. I think the physicians are now starting to, be more open than they were before. So I was very intrigued by their interest. But usually it's patient driven, and then we take it to their clinician, and then because they've seen such good results, they're open after that. And the other way is for their own health. Is they have a problem. Personal, they get introduced to me because they have a problem, and then their interest goes up.
Yeah, I agree. And this is what I usually, when someone's coming to me and they want to know about BEMER, I usually keep it very short, and I tell them, hey, both of us, before we were doctors, we were first scientists. And so let's engage on that scientific level. And so if you are interested, you're a new listener, or listening to this, you're interested in BEMER, look at the literature, request through usage-support@bemer.service, ask for a medical package, go through the literature, go on PubMed.gov and punch in BEMER vascular therapy, and look at this. It's truly the only targeted therapy at the microvascular, the precapillary arterioles. And back to metabolism, because we all talk about BEMER helps with microcirculation, but how it resuscitates vasomotion through its signal is also unique. But this idea of why does vasomotor function become disturbed and why is microcirculation decreased? You gave me a whole list of diseases in a slide I didn't put up there, but I mean, let's talk about the number of pathologies that are associated with dysfunctional microcirculation. What was the diagnosis, if you wouldn't mind sharing, that the eyes that you had going on?
I had diabetic retinopathy.
Diabetic retinopathy, and was it what kind of the hand thing you had going on?
was a Dupuytren's contracture.
Major, yeah, that's very difficult. Years with lasers and okay. So when we're looking at these things, we have a structural issue there. One's a metabolic mixed with structural issue. I see all kinds of pathophysiological perspectives that are directly related to microcirculation. But the fact that I find is we as clinicians just don't have the objective analysis to catch it. Therefore, we wait for these. And back to your sick care versus health care. Talk to me about how you engage with your clients now rather than patients about prevention, prophylaxis, and healthy living through maintaining a supportive lifestyle through therapeutic lifestyle changes or choices.
One thing I like to do is give health talks. And I like to center them around, what's the national topic of the month, for example. Like in February, I like to do a heart health type of a program. I like to do one for women because women's heart health issues present differently than men. So I like to educate women on that. So that's one thing I do. I am about collaboration. I absolutely love to collaborate. And so I like to get other health practitioners or holistic practitioners together and do a presentation for the community with several people, like 3 or 4 of us get up and speak. So that's one of the ways I try and educate the community as well as other practitioners. And that's been very successful. We hope to ramp that up as things get better in the country. We were really doing, we were doing them monthly before things changed. And I hope to see that happen again. But that's what I've done predominantly.
Community is a huge thing. And we're talking about metabolism as it relates to cells and tissues and individual people. But when we look at the relationship between one another through our community, there's also a metabolic conglomeration that happens there. How do we interrelate, intercommunicate with each other? I've found a lot of patients, a lot of individuals have put on a lot of weight over this COVID experience. Their mental health has been directly affected, their physical health, emotional health. When you look at BEMER, have you maintained the use of BEMER for both yourself as well as your clients in supporting not just the physical metabolic function, but also the emotional balance? Is that something that you talk about or you engage with your clients on?
I haven't had that discussion regarding emotional health and BEMER use.
Or psychological only type of health. I mean, when we look at brain health.
I really haven't had that discussion.
Okay, fair enough. One of the ways that I've seen it, you can measure BEMER's effects through heart rate variability, balancing the breath and the heart rate. And you can look at one of the largest studies, for those of you listening, over 656 people were looking at stress, both mental and physical, pain, as well as sleep. That's about studies on PubMed.gov. So this is something you see, and it's kind of a side effect of BEMER. And I always talk about blood's flowing, but also there's a flow state. And that has to do with brain rhythms, with heart rhythms, and also these microvascular rhythms that are occurring. They're all intertwined with each other, with one another. Have you or yourself or other individuals, patients, clients, have you seen changes in sleep patterns, either improve or not with BEMER?
Oh, absolutely. One of the things, I want to back up and just comment again a little bit about what the current environment has done. It's stress. What I've seen is stress. And certainly, sleep can impact that. And certainly we know that the BEMER can help people relax. So that, I think, has probably been psychological, emotional, whatever component that I've seen is I see it in the form of stress and helping individuals with those problems using the BEMER.
Good. And one final question I have on that, they wanted to know what settings you used for the hands when you were having that issue. Do you recall?
I was using program 1 and then just placing my hand, program 1 for the B pad, and then just placing my hands on the B body during the 8-minute session. So if I would add anything, it would be the B pad with my hands on it on a program 1, in addition to the 8 minutes on the B body.
Totally. That's exactly how I usually recommend it, is doing the full body, one of the levels, doing program 1. They could even put it over the belly area, and then you just place your hands over it. And don't forget that the field is coming out bilaterally from the applicators. any last things that you want to express regarding this idea of BEMER enhancement with supporting your metabolism before we go?
I think you outlined it beautifully in the beginning, expressing the importance of the mitochondria and how they're the powerhouse and where energy gets generated in the body. And we know that process is facilitated by good oxygen delivery. So I would just really underscore that's what the BEMER does. It delivers good oxygen and nutrients to all of your cells and your little mitochondria. And if you keep that in mind, BEMER makes all the sense in the world to giving you health and lasting health, healthy aging in all aspects. So that's my message.
Thank you. You said that so well. I want to thank you for being a guest on this evening for Medical Monday. And I appreciate you coming on taking my invitation, and I'm honored to have you on. Thank you very much. What I will do is Dr. Martinez will step off, and I'll hide myself as well. We'll leave the chat and the question and answer open a little bit, and I'll try to do my best to interface with that.